When we talk about AI in healthcare, our minds usually jump to things like robotic surgery or, discovering new drugs. But what about one of the biggest yet quietest crises in medicine today? I'm talking about the absolute mountain of paperwork that's burning out our best doctors. Today, we're going to break down a tool that's designed to fix that exact problem. Just take a look at this. This right here is the reality for so many clinicians. The patient visit is done, they've gone home, but for the doctor, the work has just started. They're facing hours and hours of just typing up notes. It's a process that steals time away from their patients, from their families, and honestly from their own mental health. This is that hidden cost of care we never really see. And look, this is not just some small annoyance. A truly staggering 78% of physicians spend over 10 hours a week. That's more than a full workday every single week just on their clinical notes. Just let that sink in for a second.
Right, so this is way more than just paperwork. It's a full-on crisis. Let's really dive into what the experts are calling documentation burnout.
The numbers, and these are coming from the World Health Organization, they're stark. Almost half of all doctors say they feel burnt out specifically because of these admin tasks. We already mentioned the 10+ hours a week that are just gone. But it also has this massive financial ripple effect, even contributing to budget overruns in our healthcare systems. So the main takeaway here, this affects everybody, the doctors, the patients, and the entire system. So how on earth do you solve a problem this big? I mean, you can't just tell doctors to type faster, right? No. You give them a co-pilot, an AI assistant that just listens and does all the documenting for them. And here's how ridiculously simple it is. First, the doctor just records the natural, normal conversation with their patient. No weird commands, no special phrasing. They just talk. Second, the AI does its thing. It transcribes the whole conversation and, this is the magic part, it automatically structures it into a perfect industry-standard SOAP note. And finally, they just export it. The note is ready in seconds, not hours. So how does such a simple process turn into such a powerful tool? Okay, let's look at the key features and benefits that really make this whole thing work so well. Now this is the headline right here. A 95% reduction in documentation time. I mean, that's not just a small improvement, it's a total game changer. For a doctor who's spending 10 hours a week on notes, that means they get more than 9 of those hours back. That's time they can now spend with more patients, on research, or, just being a human being. Of course, in medicine, a tool has to be way more than just fast. It's got to be smart, and it absolutely has to be secure. So AISOAP MX is fully HIPAA compliant with end-to-end encryption to protect patient privacy. That's table stakes. It's also smart enough to understand and transcribe over 20 languages and knows the super specific terminology for over 50 different medical specialties. And it's flexible. You can use it on your phone or on a desktop. But here's the benefit that I think really hits home. Zero writing means total attention. It lets the doctor put the keyboard down, make eye contact, and just be completely present with their patient. And it's such a brilliant example of how technology can actually help bring back the human connection in medicine, not take it away. And maybe the best part, it just slides right into a doctor's normal workflow. You open the app, you record the conversation, you get the note back in a few minutes for a quick review, and then you just copy it over. That's it. No more of those late nights trying to catch up on documentation. Now, building trust is everything, and I really like how transparent AISOAP is about what it doesn't do. It is not a diagnostic tool. It's not going to suggest treatments or check for drug interactions. Its specialty is doing one thing and one thing only, freeing clinicians from the headache of documentation. And because it's so focused on that one job, it does it incredibly well. Okay, so the features sound great, the idea is solid, but does it actually work out there in the real world? Let's take a look at the proof. While the adoption rate is pretty amazing, we're already seeing over 4,500 satisfied clinicians using the platform. And that's not just a bunch of individuals. It's scaling up and fast. Over 150 clinics, hospitals, and even entire group practices have rolled this out across their whole system. But nothing tells the story quite like a specific example. Let's talk about Dr. Garrett. This doctor went from spending 12 hours every single week on documentation down to just 36 minutes. Think about that. That is a life-changing amount of time to get back. And as you can probably guess, that kind of impact doesn't go unnoticed.
The platform was recently named the top AI innovation for 2025.
So why did it win? Well, it really came down to its innovative tech that actually understands medical context, its proven, measurable impact on reducing burnout, its ethical foundation built on privacy, and the fact that it can scale to help anyone from a single doctor in a rural town to a massive urban hospital. This quote from the company really just gets to the heart of their whole mission. This isn't about selling a product. It's about using tech to fundamentally make the practice of medicine better, more human. Which brings us perfectly to our final section, what all of this really means for the future of medicine. When it comes down to it, the promise of AI in this space isn't really just about algorithms and efficiency. It's about restoring a sense of balance. It's about using this amazing automation to give our caregivers the most precious resource in the world: time. Time to think, time to connect, and most importantly, time to care. And that kind of leaves us with this one last pretty big thought. We always look to technology to cure diseases. But maybe, just maybe, one of AI's greatest gifts to our health will be curing the system itself, starting with the burnout of the very people we trust to take care of us.